Hi Heather, it's so nice to meet you. My name is Michael and I received your referral and I've looked it over. I am a licensed therapist who specializes in anxiety disorders. Thanks so much for coming down to see me today.
You're welcome. Thanks for seeing me.
So how are you feeling about being here today?
Honestly, I'm feeling a little nervous.
Being nervous is okay. The fact that you came to see me shows tremendous strength. You have already began step one. So I read over your referral, however, I would like to hear in your words about why you decided to seek therapy at this time.
About a month ago, I had my first panic attack. It was so bad, I felt the need to go to the hospital. Since then, I've been unable to shake this feeling of overwhelming anxiety. Since my panic attack, I've been in constant fear that it will happen again. Also, I'm under a lot of stress at work. I've taken on more responsibilities in my role, and I feel as though my anxiety is preventing me from doing as well as I know I could be. I haven't been sleeping much lately, and I've had a loss of interest in my usual hobbies.
Well, first, Heather, thank you so much for opening up to me. I realize that can be a difficult thing to do. I admire your courage for seeking help and recognizing your emotions have changed. It seems to me as though you are very in tune with your feelings.
Yeah, almost too aware. It's my downfall.
I wouldn't say it's your downfall. You seem like a very emotionally aware individual who is sensitive to your own feelings and as well as others. To me, that's a positive.
Yeah, I guess. I never really looked at it that way.
So let's start at the beginning. The panic attack. Was this your first?
Yes.
Okay, and where were you when it occurred?
I was in the car driving, and all of a sudden I had an overwhelming feeling of anxiety and fear. My heart started pounding, and I felt short of breath. It's like it just came out of nowhere. It lasted for about 20 minutes, and I decided to go to the hospital just to make sure nothing was wrong. The doctor confirmed it was an anxiety attack.
Well, first, I'm so sorry to hear that happened to you. Panic attacks are very real and can be extremely discomforting when they occur. I also commend you for seeking medical treatment to ensure there were no medical issues. So it seems to me like we have several areas we can work on. The first, your panic attack. Understanding why it happened and learning tools to help it if it happens again. Second, your anxiety that you have been having since your panic attack. I want you to get a better understanding of what can be fueling it and how we can help. Third, your new job. I want us to get a better understanding of how your new role may be elevating your anxiety, and hopefully together we can learn ways you can manage your time and stress to better excel in your role. Lastly, I want to discuss the feelings you've been having of loss of interest in your hobbies as well as lack of sleep. And together, I want us to come up with some goals we can set for you to manage your progress over time. How does that sound?
That sounds great. I'm feeling better already and hopeful for the future. I really want to take control of this and start feeling like my old self again.
Well, it sounds to me like you're very determined to feel better and take a proactive approach on your health. So out of the areas I mentioned above, we will work on with you, which one feels to be the most pressing?
Honestly, I would like to learn ways to manage a panic attack if and when it occurs again. If I'm able to know what to do if a panic attack comes along, I think that will lower my overall anxiety.
Great. That sounds like a good place to start. So first, I want you to know that because you had one panic attack, doesn't mean you will have another. Some people may have one in their lifetime, whereas others may have them frequently. However, I understand your anxiety about potentially having another one. Many people get consumed with fear of their next attack. Where will it happen? When will it happen? Will it happen in a crowd, at a grocery store?
Yes, exactly. I constantly worry about having another panic attack and if it happens in public. What if I faint?
Well, have you ever fainted before or heard of anyone passing out from an anxiety attack?
No, but I know it can happen.
So I want you to start thinking about more evidence rather than your initial thought. You have never passed out before, nor has you seen anyone pass out from an anxiety attack. So based off the evidence, you will not pass out, right?
Well, that makes sense, I guess.
Exactly. I want you to become more aware of your thoughts. I think this will eventually help reduce the chances of an anxiety attack and decrease your overall anxiety. So going back to the panic attack, I want you to try to not obsess over panic attacks and instead learn to understand them and how to deal with them.
Okay, so what are some tools I can do to help with panic attacks?
Well, I want you to try to learn about deep breathing. We can actually do this exercise here and now if you want to try.
Sure, I'll try anything.
Great. So relax in your chair, close your eyes, take a deep breath, hold for 5 seconds. Now slowly let out. And one more time. Deep breath. Hold. and release. Now, how are you feeling?
Wow, I already feel more relaxed. This also makes me feel less fearful about another panic attack. I've always been one to jump to conclusions. If one thing happens to me, I feel like it'll happen again. Since I've had one panic attack, it doesn't mean I'll have another one. And hey, if I do, now I'll have the skills to deal with it.
You seem like the type of person who is very comfortable opening up to others. I think it shows tremendous courage that you're willing to share with me your struggles. I also think that you're an extremely brave person. It is hard to sit with discomfort. Your ability to do so and willingness to shows me you are a very strong woman who wants to take back control of her life.
I've never viewed myself as a brave person, but now I'm starting to feel like I am.
Great. So for the next week, I want you to practice deep breathing. Also, I want you to start journaling. When you're having feelings of anxiety, jot them down. Write down how you are feeling in that moment. Is that something you would be open to?
Yes, for sure. I think tracking my feelings would be helpful. I hope by next week I'm feeling better and can give you some good updates.
Great. Well, I look forward to seeing you in a week.